We are getting ready for the holiday season. Halloween, as you know, next week, then Thanksgiving and Christmas just around the corner. Well, that's a happy time for most of us. For so many people, the holiday season can bring some depression and other worrisome feelings. So this morning, Help for You. So happy to have Jason Reich here. He is a licensed mental health counselor. Do I have that right?
Licensed professional clinical counselor.
Licensed professional clinical counselor
Yep.
at the Memorial Integrative Medicine Associates.
Yep.
Good to see you this morning.
Nice to be here.
It's a timely conversation for us because the month of October has been a focus on depression and mental health screenings.
Yep.
You said that the way the profession really has begun to shift its approach now is really towards prevention,
Sure.
not just treatment.
Yeah, I mean, obviously mental health is going to be an issue forever, but what we can do by screening and really looking at prevention is what are the things that we can do prior to having a mental health problem, or what are the early signs of something that could develop into some significant mental health problem like depression or anxiety. And those things are really very common, but the precursors can be stopped and altered, you know.
So I would think one difficulty in talking about this to a general audience is that each person's trigger points are different. So
Sure.
where I might feel down for a day or two, somebody else could experience the same things but maybe feel down for a much longer period of time.
Yeah, there's some normal courses of mental health, but then there's such a variety in how different people feel. And that's why, you know, knowing yourself and people who know you is so important to ask them if you're feeling a little bit different, or if they say they notice a difference in your mood or how you're managing things, or if you're a parent, you see your child acting a little bit differently, they're isolating themselves a little bit more, their appetite is dropped, they're not as social as before. So being able to, for yourself, ask others, you know, and listen to what they're saying about the changes in your mood.
Let's talk a little bit though about what separates you maybe from some other people, because at the Integrative Medicine Associates, your whole approach is a whole body
Sure.
approach. So where some people may say, well, I've tried things before and it didn't work, explain how you approach your job.
Well, the idea of integrative medicine is that we use normal medical, you know, terms, normal medicines and different things like that, but at the same time we want to take differences and things that are outside of the general medical arena, and like coping skills and mental health, and we have all different kind of variety of things that help, like you said, kind of the body as a whole. So we see it as like mind, body, and soul in some ways. You know?
You also have there at the center a variety of resources that your clients and patients have access to depending on their need.
Sure.
So do you sometimes go through appointments with somebody, and as you talk you realize, you know, you might benefit from this other thing that we offer?
Yeah, one of the wonderful things is we have doctors who will refer to our mental health. We have doctors who will refer to our acupuncturist and to our deep tissue massagist and different areas. We have hormone specialists, and so I'll get referrals from our doctors all the time. They'll look at a person, they'll talk to a person and realize that maybe some of the issues that they're dealing with are maybe caused by mental health, or at least they're influenced by the person's mental health. So, and the wonderful thing about having those people all in one area, in one building, is the interchange of information is really great. And so it's really easy for me to go talk to one of our doctors and say, hey, I'm seeing this, or they can come talk to me. And so the referrals are really quickly. The information is great. And that's always been a problem in mental health and in the medical field is sharing of information.
It's not a quick healing,
No.
and it requires a lot from the patient,
Sure.
but you said you're also seeing a number of children coming in now. They also can feel strains and stress and depression.
Yeah, absolutely. And with children, it looks a little bit different. Some of the things are similar, like the loss of appetite, the isolation, the change in mood, of course. Sometimes children experience depression and anxiety more with anger than adults do. That is true for adults also, but a lot of parents will say, my child has gotten more angry. Obviously, the isolation is common for both adults and children, you know, spending less time with friends, more time in your room. And really the enjoyment of things of activities that people like to do, and that's both common for adults and children.
I know you have to be careful of your patient's privacy.
Sure.
However, if you're in a family setting and a member of the family is going through depression, that affects the whole family. So do you offer some resources and guides for the family to know how to aid?
Absolutely. You know, one of the things that we try to do is always involve the family. Most of the time when you're talking about mental health, a lot of the things that are brought into mental health have to do with the family, and at the same time, also some of the solutions have to do with the family, especially when you're talking about children. You know, usually the root of some of the struggles are family systems issues. And even with adults, you know, it might be marital problems. And so whether or not the cause of the mental health issue, the depression, the anxiety, has to do with the marriage, the relationships with family, ultimately the solution largely has to do with how the family reacts to that. Because you're going to need the support. It's
good that we have the month dedicated to this, but are we seeing a reduction in the stigma that can come with mental health? Is it beginning to ease?
I think so. I think that depending on the people and the location, that matters. You know, some of the our bigger cities and things, it's it's almost like you see that rise. People are seeing counselors all the time,
right.
But we still have this stigma, and it comes in two forms largely: the social stigma, which is what other people think of mental health, and then the personal stigma is what we believe about our own mental health. And so we often see the social stigma saying, wow, if you have mental health issue, you're not strong, you're weak,
right.
you can't deal with things. And the personal stigma is very similar to, thinking that I'm crazy, or so we are coming a little bit away from that. People don't tend to look at mental health as a crazy thing, but
right.
at the same time, there's definitely a stigma that keeps people from getting help.
Having someone there who will validate what you're feeling means the world. Having
Absolutely.
someone who will listen to your own personal perspectives will mean everything. And you'll find it, Jason Reich at Memorial's Integrative Medicine Associates. You can simply call their office and ask for an appointment for him. There's
Absolutely.
no referral needed. There's their number, 643-2246. And the website that you see as well. Whether you're starting this journey for the first time or perhaps have been going down this road with no success, give them a call. They'll help you on your way. Thank you, Jason.
Very well.
We're back after this.